Good day, this is Mignodel Morales from Trinity University of Asia, sharing with you my dissertation, The Perception of the Nurse Managers on the Patient Safety Culture and the Safety Culture Maturity Level of Selected Internationally Accredited Hospitals in Metro Manila, Philippines. In healthcare, there's a 1 in 300 chance of patients being harmed during confinement. Industries with higher risk, such as aviation and nuclear industries, have a much better safety record than healthcare. A well-grounded culture on patient safety affects clinical outcomes, safety of healthcare providers, the financial capacity of the organization, and the satisfaction of patients and also the employees. Based on the researcher observation, one adverse event, such as fall with injury, could cause financial burden for the organization, increasing the length of stay due to another clinical problem such as broken bone, which might lead to another possible nosocomial infection. The researcher seeks to explore the relationship of patient safety culture maturity level among tertiary international accredited organizations towards creation of a model. What are gaps? Limited researches regarding patient safety culture and safety culture maturity level, lack of patient safety culture models in the context of the Philippine practices, superficial analysis of patient safety culture in terms of their components. Patient safety culture model from Agency for Healthcare Decision Quality had been adopted by the researcher. Safety culture is composed of management support, effective communication, commitment to organization learning, transparent reporting, and teamwork. It is affected by different factors such as human factors, management systems, communication systems, and others. The researcher also used the safety maturity model of Edward Fleming, which has 5 levels: emerging, managing, involving, cooperating, and continually improving, which is, if there's increasing level, it is improving safety culture, and there's consistency. Methodology. The researcher used mixed methodology, triangulation, concurrent parallel method. It is quantitative and qualitative approach. Our setting is international accredited institution, tertiary level hospital, 200 to 300 bed capacity. My respondents or the researcher respondents are nurse managers, regardless of units and departments. My sampling method is purposive convenient sampling. Responsive rate is 93%. My study variables is demographic profile, including age, sex, educational attainment, and length of service. It will be correlated to the patient safety culture and the safety culture maturity. Data collection and analysis. The phase 1 is qualitative phase, which we will use the adapted questionnaire from Agency for Healthcare Research and Quality, the self-made questionnaire based on Fleming's model, with Cronbach alpha 0.86. The phase 2 is the quantitative phase, wherein there's open-ended question in the survey. And the last phase is analysis. For quantitative analysis is statistical analysis, and for qualitative analysis is thematic analysis. My results and findings. For the demographic profile based on the respondents, there is 51% under 30 years old. It's more the millennial type. The sex or gender is 70% female. Educational attainment is 84.3% is Bachelor of Nursing degree. And our length of service is 46% composed of 6 to 10 years length of service. Based on the safety practices mean scores, as you observe, the lowest 3 is hand-off and transition, communication, openness, and staffing. Based on the safety culture maturity level, you can observe that the highest is in the managing level. The relationship of safety practices to the demographic profile, as you observe, based on age, there is relationship between the age, the sex, and the educational attainment and length of service based on the teamwork across the units, communication of openness, and staffing. So as you can see, because of the age group of less than 30 years old, they are millennial type, that they have that openness of communication. They're very empowered to verbalize their concerns. And teamwork across the units, they have this feeling of cohesiveness to others. And with the sex, gender, it is more on because of there's differences in dealing with a female staff and the male staff. In educational attainment, as you can see, there's rejection of the null hypothesis. There's a relationship between teamwork across the units and staffing related to educational attainment, because based on the Republic Act 9173, our nurse managers should have at least master's level. And length of service, because of their experience within the organization, they have the tendency to adapt in this limited staffing, and they can relate to a more experienced staff in other units. Relationship safety culture maturity level to the demographic profile. As you observe, there's relationship between the age and the length of service, because as we age, we have this increasing number of our experiences, which lead to a much more mature in decision making and analysis of situation. Based on the correlation analysis of significant relationship between safety practices and safety culture maturity level, 0.040, low positive correlation, and with no significant correlation. Based on the qualitative analysis, safety practices, based on the thematic analysis, it's effective communication with protocol and policy adherence, managing safe environment, leadership involvement, diminishing workforce, and precedence of care. For safety culture maturity, the themes emerge are development opportunities, collaborative endeavor, and sustainable change. And for relationship of safety practices and safety culture maturity, standards, initiated action, holistic and motivating culture, coherence and compliance, organizational transparency, and care for the environment. Demographic profile of the respondent affects the patient safety culture. As you can see, based on our results, the age, the sex, the length of service, and the educational attainment has directly affect our patient safety culture. In terms of age, there's multi-generational workforce, which means that there are ones that they can have the initiative. Some of the staff should have a policy to guide them for the procedures. And for gender, nurses, our majority is in a female part. However, there's an increasing number now of male nurses. So there's differences between managing the expectation not only by their staff but also their patients. And regarding their educational attainment, the majority of our nurse managers is bachelor's degree holder. that needs to have and should be addressed by the human resource management for them to be equipped formally with additional tools for them to decide well and plan well within their units. And last is length of service. The length of service determines how they manage their unit. The higher the length of service, the more experienced they are and the more cases they've been through. So through experience, they've learned and they've decided based on their learnings. Leadership have a pivotal role in promoting culture of safety because based on our results, the highest mean score for patient safety practices is management of patient safety. Management is the foundation of changing culture. Leaders should be a role model in changing behavior. The identified components for improvements were staffing, communication openness, and hand-off and transition. Staffing, communication openness, and hand-off and transition is also the lowest three components of Agency for Healthcare Decision Quality 2018. This problem is not only present in the Philippines, but is also present in the world. Staffing problem is due to the declining of nurse enrollees, the K-12 scheme of Department of Education, and other nurses go abroad for greener pasture. For communication openness, based on the culture of the Philippines, we are hierarchical in nature. It is more on we follow, we obey the rules based on the hierarchy of the healthcare organization. Here in the Philippines, we have that highest respect to our physician. And there is a gap and barrier to that practice, that the nurses are having that difficulty to be empowered to voice out their concerns. And handoff and transition, it can be multi-variable and multifactorial causes because handoff and transition is very complex, even though we have the standards, but it is also bounded in the communication process of your units. Safety culture maturity level based on the respondents was on the managing level, which defined as following process and procedures in place. This maturity level was correlated to the demographic profile of the respondents. In the qualitative analysis, it was correlated to the results of the findings, which were the leadership roles, the importance of processes, the manpower struggles, and the safety encompassing environment and staff safety. This research was limited to the nursing service perception. The respondents were managers on the tertiary hospitals. To conclude, patient safety culture is affected by the structure of the organization, which includes human capital. There should be credible and competent employees. It was also affected by the leadership of the organization. The changes of culture should be emanated on the top. The leaders should be visible, active, and participate in patient safety initiatives. Human resource management and communication were the identified factors affecting the safety culture. Thus, based on the findings, the researchers recommends to have a continuous improvement in the process of recruitment until succession planning of staff to prevent manpower issues. Communication will be improved through policy review and creation of innovative solutions such as collaborative notes and multidisciplinary grounds. Safety culture maturity is based on the continuous improvement of the organization. The accreditation is not a gauge of maturity of healthcare organization. It is founded through the efforts of the healthcare organization in achieving their mission together with inclusivity and growth of, and development. In sustaining high reliable care, the researcher recommends to utilize the proposed model created from these findings. Morales model sustained safety practices for reliable care. It is composed of three components: the core, the mantle, and the crust. The core is our goal: sustained reliable care. It means it is your end goal that all of our patient, our staff is safe, and we're giving a reliable care, and there's no changes, but it is continuously improving through time. The mantle is composed of the safety practices that had been identified in the findings, such as communication openness, feedback, teamwork across the units, staffing, organizational learning, handoff and transition, non-punitive approach, and management support for patient safety. And the last is the crust. The crust is how these safety practices will be sustained. It will sustain if the leadership supports the patient safety initiative and the safety practices imposed. Next, it should have a proper communication processes across the organization. Then it should have procedures and processes in place. And in the structure, there should be proper human allocation and human resource management. And there's is continuous cycle of improvement. Quality is everyone's responsibility by Edward Deming.